everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local. And if you tuned into last episode, you would know that this is Dr. Melissa Richards, the Division Chair of Hospital and Surgical Services at Olmsted Medical Center. And we're joined again by Carrie Rochester. She is a certified nurse midwife, and she also is a certified sexual health counselor. And we find this fascinating.
Amazing.
Which is why you're back for episode number 2.
Sequel.
Right? The
Mhm.
sequel. The sequel. We were joking before we started taping here that the theme song for this episode is "Let's Talk About Sex, Baby."
How much can we talk about this song, though,
Right.
before we have to pay up?
No, that's all.
Okay,
I
that's
think,
all you're getting.
I think that's all you're getting. So we talked about in the last episode all about the fact that you are offering services for people at Olmsted Medical Center who have questions about sexual health concerns, questions, want to be treated, and there's many things that can be treated
Mm-hmm.
with sexual health. But
Mhm.
we're talking today about pain during sex.
Mhm.
It's a big topic.
But sex isn't supposed to hurt, so it's fine. I'll just put the penis in and hold my
Yeah.
something,
Well,
and
that's
we'll
one
just count
way.
to 20, and then it'll be done.
Right?
Right?
Yeah, like disassociate a little
Yeah.
bit.
Super.
Yeah.
Great.
Yeah, and so people think that's quote unquote normal, and then that's just what you do as the woman in the relationship as you suffer through that pain.
Mhm.
And that is not baseline.
No.
No. So expand. Say more about that. Say, what would you say if somebody comes in and says that they're having pain during sex? What does that exploratory stage look like? What do you talk about? These sorts of things.
Where is the pain exactly?
Mhm.
Does the pain start with insertion?
Uh-huh.
Is it deep penetration pain? How
Uh-huh.
long has the pain been there? Are you able to insert tampons? Has Is this new with a new partner, or has it always been this way? So a lot of probing questions to kind of get to the core of the pain during sex.
Sure. And out of the patients that you see, how often is pain during sex brought up or talked about?
You have to ask it oftentimes. I mean,
Yeah.
the trick is asking, right?
Yeah.
So typically patients don't come in and they're like, oh my gosh, when the penis goes in, it's horrible.
Uh-huh.
Like most patients don't do that, right?
Right.
So, the onus is on us as clinicians, but it's very common, at least at minimum, 1 in 4 women have issues, or 1 in 4 people with vaginas have issues with pain during sex. So, in their lifetime, depending on what's going on. And there are different times in our life where
Right.
things that didn't cause pain during sex are now causing issues. And if we don't ask as clinicians, it's oftentimes really hard for patients to say something. There's a lot of stigma around sex. It's funny, half of our patient population, why do they come see us? Because they're pregnant. And how
Right.
did most of them become pregnant?
Yes.
The penis went in the vagina.
Right.
But beyond that, we don't talk about that. So really, even in our department, the importance of asking.
Mm-hmm.
And then I would say, if a clinician, in my humble opinion, should feel comfortable asking those questions. But if they don't necessarily feel comfortable with the patient asking those questions, at least letting them know, one way or another, that I want you to feel comfortable having this conversation. So we do have a women's health department. We do have a sexual health specialist at OMC to answer questions. If you have questions, I want you to know that those resources are available in the event. I, as a clinician, don't feel comfortable asking those questions, and a lot of that is education, and we're getting better, and we're asking more of ourselves. But then, if we're not really at that point, and making sure that our patients know that we have resources available.
Yeah, it goes back to clinicians not wanting to ask questions that they don't know how to answer.
We're humans, to be honest.
Yeah.
We are
Right.
human beings.
Right.
Yeah.
And, I trained at a very wonderful, fancy place. I'm so proud of the training that I received. But sexual health, much like most programs, we don't really talk about it that much.
Right.
And I think, you know, I'm just so appreciative of medicine and OMC addressing areas of health that are outside acute,
Hmm.
right? It's not
Mhm.
addressed because it's not an acute issue. It's not a
Life
life
threatening,
threatening
life or
or
limb.
life
Yep.
altering or life, well, certainly life altering, but life threatening condition. So, you know, it's an understanding though that you're as a whole person, it's part of it.
Mhm.
Hmm.
And so having good sexual health is part of your whole person wellness.
Hmm.
And I just think that it's really important for anyone listening to understand, again, that we talked about in the last episode, like there is nothing to be ashamed of here.
Mhm.
Just
No.
like you're addressing, let's say your kidney is not functioning right. Well, you're going to address that. Or how about mental health? Your mental health is not functioning right. You're going to address that.
Hmm.
So if you have sexual health concerns, and it's taboo, isn't it? It's still taboo to talk about it.
Hmm.
But there's people that are very easily reachable
Hmm.
that
Mhm.
can help. Um, I think it might be helpful though to even talk about some some things that might cause pain, or maybe what's a condition, or something, so maybe it's something even easily treatable like dryness or these sorts of things. So
Mhm.
maybe we can talk and touch on some of these things that would cause pain, or even if they have a name that are causing that pain.
There is a medical condition called vaginismus,
Mhm.
and that is anything that touches the introitus. So that's the opening part of your
Mhm.
vagina. Your pelvic floor automatically clenches
Okay.
and causes pain with trying to insert anything, like even a tampon.
Oh, okay.
Um, that is a much more kind of intensive therapy, which would involve like pelvic floor physical
Gretchen.
Okay.
therapy.
It would involve Gretchen.
Yes.
I was
Yay.
actually thinking, have you had, I know this is an aside, have you had any pelvic floor physical therapists?
Yeah, so this goes back to Gretchen, who
Hmm.
we had on a previous
Hmm.
episode of Pelvis
Hmm.
Party, who taught us kind of the mechanics
Hmm.
Mhm.
of your pelvis and what can be done to treat different things. So it sounds like, wow, OMC working with all of these different areas
Hmm.
Mhm.
to address, again, the needs of the patients. We've got
Mhm.
OBGYN working closely with sexual health counseling, working closely with physical therapy.
Mhm.
Oh, I just
Pelvic
love
pain is
it.
complex,
It's
It's
man.
so
very complex.
complex.
Yeah.
And it's not typically like, oh, I had pain with sex, I'm going to go see the doctor. Or I've had pain with sex for the last month, I'm going to go see the doctor. Or I've had pain with sex for, I don't know, the last 40 years. And now I'm going,
Mhm.
that's typically the story, actually,
Mhm.
not 40 years, but
Yeah.
it's been going on for quite some time. And we have to retrain. Um, you, you retrain the muscles when we talk
Mhm.
about things like vaginismus, or your
Mhm.
pelvic floor is amazing. It's trying to protect you, right?
Mhm.
So think about other muscle groups. If other muscle groups are having issues, we send you to physical therapy
Right.
and work with our physical therapist. Your pelvic floor is exactly the
Exactly the
same.
same. So
Absolutely.
there's a physiology involved, but then there's also physicality involved because it's supposed to cause pleasure.
Mm-hmm.
And it's so complex. I was just reading a little bit about stretching and the
Mm-hmm.
importance of stretching, and this stretch reflex that you have, and how it's so complex and tied to your nerve endings
Mm-hmm.
and
Mhm.
reinnervation and these
Mhm.
sorts of things. And I would imagine that this is the same. So again, tying back other things that we see so integral into our health,
Mm-hmm.
stretching, being good to your body in these sorts of ways. Same thing.
Right.
Pain with
Mhm.
sex.
Absolutely.
Let's get
Mhm.
that addressed.
Absolutely. Like
Mhm.
Carrie, can you give a great, like my favorite, because it's people are can really understand it, the concrete situation. I was premenopausal, had no issues with sex, and now I'm postmenopausal and I don't use lube because I didn't need to use lube
Right.
before, and now
Mhm.
I have pain with sex. Why? Why?
Mhm.
And please, like this is so common. Like
Uh-huh.
so
Right.
when a patient comes in with that, what do you talk to them about?
I talked to them definitely about vaginal estrogen,
Mhm.
right? With those genital urinary symptoms of menopause.
Yeah.
So definitely talking about vaginal estrogen as well as using lubricant.
Yeah.
I recommend lubricant for everybody, even though if you feel like you're quote unquote well lubed,
Uh-huh.
lubricant doesn't hurt anything and it
No.
only enhances
Yeah.
your experience.
Right.
I also talk about certain positioning as well.
Sure.
There are a ton of
This is so
aids out
huge,
there.
right? I think everyone thinks like however they put the penis in, it's like a key into a lock. And they're like, well, I can't do it missionary style. And that's the way we're supposed to do it. And I'm like,
Yeah.
your uterus is when that penis goes in, is going, like
Right.
you're
Yeah.
stretching so many
Right.
ligaments.
Right.
Like we got to try something different, everybody.
Right.
But it's nice to have a specialist who can actually give the, more concrete ways to explain
Yeah.
it.
Well, and as an aside, our society has definitely conditioned people with vaginas to think that we have these multiple orgasms in missionary
Uh-huh.
style. Well, that's not the case.
Uh-huh.
Less than 20% of women orgasm
Oh.
from
Wow.
vaginal penetration. That's a whole
Uh-huh.
nother.
That is a whole.
Yeah, that's a
Shall
great
we have
episode.
you back, Carrie?
Mhm. The myths of
Yeah.
sex,
Yeah.
definitely.
Yes.
Yes.
Yeah, that's a whole nother episode, but definitely like back to the dryness, vaginal
Mhm.
lubricant, um, vaginal estrogen
Why
for
Yeah.
is that
sure.
though? So I know I am a doctor. I know
Oh, what a relief.
I know. But the vagina loves estrogen.
Yeah.
And when we go through menopause, our estrogen levels drop, right? So the
Mhm.
vagina becomes less stretchy,
Right.
less thick,
Right.
and less lubrication. It is a
Right.
normal process.
Right.
Now, that doesn't mean that you just are like, well, I guess this is where we are now, right?
Mhm.
We're
Right.
women, we pivot. We're
Right.
people with
Right.
vaginas, we pivot. Like we know
Mhm.
how to pivot. And so we figure out our pivot. And if we need help with our pivot, we talk to an OBGYN, we talk to our sexual health specialist.
Uh-huh.
Like we can do this. And like if you don't mind me just busting it because this is
No,
something as an
yeah.
OBGYN I feel very passionate about and it's something that people just don't know. And
Right.
vaginal estrogen, that's estrogen. Carrie, that's estrogen. We don't want to be on estrogen.
Oh.
Topical
Yes.
estrogen different than
Yes.
systemic
Yes.
estrogen and really explaining that to patients and understanding
Mhm.
that's also a process, right?
Mhm.
Vaginal estrogen, it takes like 3 months to really
Mhm.
re-estrogenize that tissue inside the vagina, but we can take a 60-year-old vagina and kind of turn it into a
Wow,
30-year-old
that's
vagina.
amazing. So there's topical estrogen.
Yeah.
Mhm.
Fantastic.
As another aside, there's a great medication called Intrarosa, which is not actually estrogen isn't in it. When you insert it in the body, then your body compounds it to estrogen. But unfortunately, insurance does not cover it.
That's a whole nother episode too.
Yeah, they cover Viagra. Yeah. But an
Mhm.
Intrarosa is actually marketed for painful intercourse postmenopausal. Yeah. Yeah.
Fascinating.
So talk about positioning. There are a ton of like bolster aids out there
Sure.
to help with positioning.
Yeah.
There are what are called collision dyspareunia products
Uh-huh.
that a man could wear on his penis,
Uh-huh.
and that will kind of put a barrier to how far they can put their penis in the vagina.
Mhm.
Oh, I see. Okay.
You
So
can also do dilator therapy. Yeah.
so what we're saying is there are treatments.
Yes.
Mhm.
And there are options for people who are experiencing pain during sex. So again, this is coming back to what we say over and over and over on Pelvis Party is if something is amiss, if something is awry, do not brush it off. We are loved and cherished human beings, and we do not need to settle for that.
Mm-mm.
We
Mm-mm.
don't. There's help available. And so if someone is experiencing pain during sex, they don't need to have a referral from their primary. They can call up the
Mhm.
OBGYN Department of Women's Health Services at OMC and ask to get on your schedule
Or my chart.
or my
Or
chart.
my chart. Yeah.
Mhm.
Yep.
Excellent.
Yep.
So lots of ways to get in contact with you. Well,
Absolutely.
thank you for joining us to talk about this super important topic. And thank you to you for
Mhm.
your I don't know what the hell.
That's fine.
For your expertise as well.
Yeah. And thank you to you for your expertise in this area as well. And to all of you, thank you so much for tuning into this episode of Pelvis Party. If you're looking for more exciting topics, please check out rochesterlocal.com/pelvis party.